Well, thank you very much, Chairman Blunt. Welcome, Secretary Azar. People across the country made pretty clear last November that they want us to fight for their health care and make sure families get the care they need. That means fighting for protections that allow people with pre-existing conditions to get quality, affordable health coverage. It means fighting to bring down the skyrocketing health care costs. It means fighting for public health investments that keep our communities safe and address crises like the HIV and opioid epidemics. And it means fighting for investments in research that can help discover new treatments, save lives. But instead of fighting to defend people's health care, President Trump is fighting in court to take health care away from millions of people who are covered through the exchanges, covered through Medicaid, and are covered by their parents' plan. Instead of fighting to bring those costs down and help people get the care they need, he is fighting in court against protections for over 130 million people with pre-existing conditions, for bringing back annual and lifetime caps on benefits, even for people who get their insurance through their own job, and for letting insurance companies offer plans that don't cover essential services like maternity care or prescription drugs. And President Trump's budget before us is cut from that same cloth. It bulldozers right over the concerns of families with proposals that would make it harder for people to get care, and cuts that would undermine the well-being of families across the nation. Overall, this budget proposes a deep $12.7 billion cut to the Department of Health and Human Services, slashing it by 14%. I always say a budget is a reflection of your values. Well, like many of his actions, this budget tells a very different story about President Trump's health care priorities than his empty promises. Despite claiming time and time again he would fight for people's health care, and despite his recent claim Republicans would be the party of health care, President Trump is continuing to push for harmful policies that would weaken patient protections, take coverage away from people, and put needed health care further out of reach. This budget includes Trump Care, which the Congressional Budget Office estimates would kick tens of millions of people off their health insurance. When it comes to curbing the HIV and opioid epidemics, President Trump promised to fight the fire, but his budget actually fans the flames. It would make these crises far worse by cutting over $1 trillion from Medicaid over the next decade and repealing Medicaid expansion. Medicaid is the largest source of insurance coverage for people with HIV, covering more than 40% of people with HIV in care. And the 37 states that expanded Medicaid show how it can play an important role in addressing the opioid crisis as well. In some of these states, as many as 4 out of 5 people receiving treatment for opioid addiction are insured by Medicaid. The Centers for Disease Control and Prevention also plays a very important role addressing these public health crises and many others, yet the Trump administration proposes cutting its budget by 1/10. This proposes cutting immunization efforts by $78 million, even amid an alarming measles outbreak in my home state and several others. It proposes cutting work on birth defects and disabilities by $44 million, and proposes cutting efforts to combat antibiotic-resistant pathogens and emerging infectious diseases by $103 million, despite the World Health Organization labeling AMR, quote, one of the biggest threats to global health. And when it comes to medical research, this budget is a small step forward and a marathon sprint back. I do applaud the administration's call for more pediatric cancer research. For every new penny President Trump proposes for pediatric cancer research, however, he proposes cutting $1 from the National Institutes of Health. Cutting medical research by 13%, as he proposed, would slow our efforts to advance our understanding of Alzheimer's disease, develop vaccines for HIV and flu, and treatments and cures for every other kind of cancer. And at a time when our nation is facing a health professional shortage, it's proposing to cut almost $800 million from healthcare workforce training programs that support tuition assistance, loan forgiveness, and training for several 100,000 health professionals annually. This budget also continues the Trump-Pence administration's harmful trend of putting ideology over women's health and reproductive freedoms. Its language specifically excluding Planned Parenthood from federal funding is just one of the many alarming steps backwards for women's health care from this administration. Another is the recent announcement stripping Title X family planning funds from several qualified Planned Parenthood affiliates, despite their proven record, helping millions of people struggling to make ends meet, get birth control, cancer screenings, and other basic health services. Another example is the administration's gag rule, which will push Planned Parenthood out of the program altogether, interfere with patients' ability to learn about their full range of reproductive care options, and prevent people from across the country from getting the care they need with the providers that they trust. Once again, the Trump administration proposals eliminating safety net programs that provide critical assistance to millions of vulnerable families, like the Low-Income Home Energy Assistance Program, which helps families afford heating and cooling, and the Community Services Block Grant, which gives states resources to address the challenge of poverty, and eliminating funding for preschool development grants, which provide high-quality preschool to tens of thousands of families. It's clear that we are facing a child care crisis in this country. Parents struggle every day to find and pay for high-quality programs. We need more investments in that, not cuts in early childhood education. And this budget continues to show disregard for families fleeing violence and extreme poverty in Central America. This budget proposes a gimmicky $2 billion contingency fund on the mandatory side for the Unaccompanied Children Program, in addition to the base discretionary appropriation. Let me be clear. I want to make sure that every child in HHS custody is well cared for. But I have been deeply disappointed in President Trump's treatment of migrant children, from heartlessly separating children from their parents to attempting to undermine protections for migrant children. And I have been frustrated with your department for failing to sound the alarm on the lasting damage that family separation would cause, sharing information with the Department of Homeland Security so they can target potential sponsors for deportation, and relying heavily on unlicensed temporary facilities, which are 3 times as expensive as permanent beds in licensed centers. To say nothing of my concern that the Office of Refugee Resettlement was tracking young women's reproductive health, and that former Director Scott Lloyd was personally interfering with young women's decisions about their bodies. Finally, Mr. Secretary, I am concerned by a recent proposal you outlined in a letter to my office to restructure the Office of the Assistant Secretary for Health. That restructuring would impact programs that serve adolescents, women, low-income communities, and more. And I'm very concerned that that proposal, much like this budget proposal, would serve very little purpose beyond prioritizing ideology over the health needs of families in this country. Mr. Secretary, finally, I just want to note, it is inaccurate to claim the Budget Control Act requires the President to submit his budget at sequestration levels. In fact, just 2 years ago, President Trump's budget proposed an increase to the caps for defense spending. So I hope you don't rely on that excuse for decisions in this budget. Thank you very much, Mr. Chairman.